So my name is Theodora Sprato, and I'm Executive Director with Environmental Health Trust. I have submitted extensive...
Sorry, did you spell your last name?
S-C-A-R-A-T-O. And it's Theodora with an A-I-N. Theodora, T-H-E-O-R-A.
Thank you.
And Environmental Health Trust is a scientific think tank, and we submitted substantial comments and attachments to the commission as well. I do respect the challenge before you, and I just want to add really quick that you can regulate to a degree, because this is about future needs and also about speculation, and service is different from capacity, and I can talk to you about that afterwards. History is rife with those moments where regulations in the books have not caught up with science showing human and environmental harm, like paint, asbestos, cigarettes, the spraying of DDT and Agent Orange on entire countries and our servicemen and women. And this is that moment when Washington, D.C. is ground zero, poised to allow 5G in the front yards in front of people's bedrooms, even though the American Academy of Pediatrics and countless medical organizations are recommending that we decrease exposure to this radiation, and the people are completely uninformed. Environmental Health Trust did share technical information related to the radiation frequencies currently used and 5G, which will be in use as well. There are over 250 scientists calling for urgent action to protect the public. Not only will small cells expose people to a radiation that is considered in peer-reviewed research a human carcinogen by independent scientists, but this radiation has also been shown to affect bees, birds, and trees. Next slide, please. When the chief of obstetrics at Yale, who is also the National Academy of Sciences, did research exposing pregnant mice to cell phone radiation, he found the mice had what he would say, if there was a term for this, if mice could have ADHD, that's what they had. They were born with, they had damaged memory, and they were hyperactivity when they did tests when they got older. This corroborates research in humans and other animal studies that has found memory problems and brain damage. There are actually multiple studies, which I believe there's references in what I sent to you. The Baby Safe Project, which I have a slide from the website, has been signed on to by over 200 medical experts and educational experts, as the EPA recognized as well. They recommend reducing exposure. I do have handouts for you on this, to protect babies' brains. I want to tell you that wireless companies, next slide please, are warning their shareholders. As an example, Crown Castle states in their 2016 10K report, we cannot guarantee that claims relating to radio frequency emissions will not arise in the future, or that the results of such studies will not be adverse to us, and if a connection between RF emissions and possible negative health effects were established, our operations, costs, or revenues may be materially and adversely affected. We currently do not maintain any significant insurance with respect to this matters, because 20 years ago, insurance company decided not to insure companies because of the brain cancer cases that were moving forward. And of course, the research has significantly increased since 20 years ago. Many wireless companies from AT&T to Nokia, Sprint, all of them actually have issued similar warnings to their shareholders. Why not, if we are going to deploy this, are not the people of Washington, D.C. being informed, just as these shareholders are being informed about this issue? Because really the people are not aware right now. There are white papers of insurance industries that compare this risk to asbestos. They classify it as high risk. And that is why most insurance companies will not insure for electromagnetic radiation. They do not insure for damages. It is considered a pollution. It's defined as a pollution. You have to buy a special pollution clause. Cities nationwide are opposing the unfettered rollout of 5G. As was discussed, I believe that public spaces should be safe and environmentally healthy for our children and for the elderly and for people with immune systems which are compromised, of which research has shown harm. And children are more vulnerable. They absorb, the radiation is penetrated deeper into their bodies. Now, if the citizens own the right of way, then they should be fully informed about these health effects, about the studies that are showing harm. Because this, you said this was your most valuable asset with the right of way. Then I think our children and the people are our most valuable asset that would be in this asset that they own. The EPA was defunded from setting proper safety limits. We have no federal safety limits related to radio frequency radiation in 1996, and at that time we adopted the outdated limits that we have. I think the conversation needs to pivot and be about protecting the people from this pollution, which is being called environmental pollution. I sent you Dr. Sidney Russell's published paper on 5G because the millimeter waves, which are going to be employed in 5G, are used as weapons at a much higher power. But because of the way they affect the sweat gland, and I can talk to you about that, I'm quite familiar with the research and the researchers. We did an international conference where we had presentations as well. The FCC is under regulatory capture right now, and there is actually no federal health and safety agency that has done any systematic review of the current science to understand at what level is this safe. So what we have are outdated limits based on outdated and erroneous assumptions that heat is the only problem. Microwaves obviously will heat you. So it was set so that you're not heated 1 degree Celsius. Before allowing these antennas, I think there should be a cost-benefit analysis in terms of medical bills to the District of Columbia. Because if indeed what happens in the rats and mice, such as the National Toxicology Program that found clear evidence of cancer from cell phone radiation at non-thermal levels, then I think that the government is going to be incurring costs, and it should be looked at. And I'm glad to answer any questions. I actually want to just say that, this is not a public utility. So they're not, landline phones are regulated as a utility, but there are not such regulations with this. And so they don't even have to fix things they put out, and we consistently will see certain populations not getting what they need, and there are no regulations in place to ensure that. And I would like to be clear that you know the difference between service and capacity. Right now, there is service. So why would we be putting something in that can cause harm?